Diabetes affects over 37 million Americans, with women over 60 representing one of the highest risk groups. According to the Centers for Disease Control and Prevention, approximately 30% of women over age 65 have diagnosed diabetes, and another 15 to 20% have undiagnosed diabetes, meaning they have the disease but don't know it yet. What makes diabetes particularly dangerous in women over 60 is that symptoms often appear differently than in men or younger adults. The classic textbook symptoms of excessive thirst, frequent urination, and unexplained weight loss that doctors traditionally teach do occur, but many women experience unusual subtle symptoms for months or even years before diagnosis. Research published in Diabetes Care examined gender differences in diabetes presentation. Studies found that women over 60 frequently present with atypical symptoms that don't immediately suggest diabetes. These unusual symptoms are often dismissed as normal aging, menopause effects, hormonal changes, or unrelated conditions. Meanwhile, uncontrolled high blood sugar silently damages blood vessels, nerves, kidneys, eyes, and heart. By the time diabetes is finally diagnosed through routine screening, serious complications, including neuropathy, retinopathy, nephropathy, and cardiovascular disease, may have already developed. What makes early recognition crucial is that diabetes complications are largely preventable with proper management. When blood sugar is well controlled through diet modifications, regular exercise, weight management, and medication when necessary, the risk of heart disease, stroke, kidney failure requiring dialysis, vision loss leading to blindness, and foot amputations decreases dramatically by 50 to 70%. But if diabetes goes undiagnosed and untreated for years, irreversible damage accumulates in multiple organ systems simultaneously. In this video, we'll examine 8 weird diabetes signs that women over 60 frequently experience but rarely recognize as diabetes-related. The first 3 signs involve skin and infection problems in specific areas of the body. Number 5 appears in a location most women would never think to check for diabetes symptoms. These aren't the typical diabetes symptoms you've heard about, like excessive thirst or hunger. These are unusual signs unique to women that indicate high blood sugar is affecting your body in unexpected ways. Before we begin, understand that experiencing 1 or 2 symptoms doesn't definitively mean you have diabetes, but persistent symptoms, especially multiple symptoms occurring together, warrant blood sugar testing. Early detection allows treatment before serious complications develop. Now let's examine the weird diabetes warning signs your body is sending. Sign number 8. Recurrent yeast infections in the genital area that keep coming back despite proper treatment. Starting with one of the most common but rarely discussed symptoms, frequent recurring vaginal yeast infections can indicate undiagnosed diabetes. Here's why this happens and why it's particularly worse in women over 60. Yeast, specifically Candida albicans, normally lives on skin and in the vagina in small, controlled amounts, kept in check by healthy bacteria and normal immune function. When blood sugar is elevated above normal levels, glucose appears in vaginal secretions and on genital skin, creating an ideal nutrient-rich environment for yeast overgrowth. The yeast organisms feed on the sugar, multiplying rapidly and overwhelming normal bacterial balance. Additionally, high blood sugar significantly impairs immune function in multiple ways. White blood cells don't function properly when bathed in excessive glucose. Their ability to engulf and destroy pathogens is reduced by 40 to 50%. Your body's ability to control yeast growth decreases substantially. After menopause, declining estrogen levels cause vaginal tissue to become thinner, drier, less elastic, and more susceptible to infection and irritation. The combination of high blood sugar providing fuel for yeast, impaired immunity reducing defenses, and postmenopausal vaginal changes creating vulnerability creates perfect conditions for recurrent, persistent yeast infections. Research from the Journal of Women's Health examined yeast infections in women with diabetes. Studies found that women with poorly controlled diabetes with hemoglobin A1C above 7% had 3 to 4 times higher rates of vaginal yeast infections compared to women without diabetes or with well-controlled diabetes. Many women experienced their first yeast infection or noticed infections becoming dramatically more frequent in the months to years immediately before diabetes diagnosis. Some women had yeast infections monthly or even continuously. The characteristic symptoms include intense, severe itching in the vaginal area that interferes with daily activities and sleep, thick, white cottage cheese-like discharge that's different from normal discharge, burning, stinging sensation during urination, pain or significant discomfort during sexual intercourse, and redness, swelling, and irritation of vulvar tissues. What makes this a diabetes warning sign rather than just a typical infection is the pattern of recurrence. An occasional yeast infection, once or twice yearly, is relatively normal and doesn't necessarily indicate diabetes. But infections occurring every few months, infections that clear completely with antifungal treatment then immediately return within weeks, or infections that never fully clear despite multiple treatment courses, suggest an underlying metabolic problem like diabetes fueling the infections. What distinguishes diabetes-related yeast infections from typical occasional infections is several factors. The infections are more frequent, occurring 3 to 4 yearly or more. They're more severe with intense symptoms. They respond poorly to over-the-counter antifungal treatments that previously worked well. They clear with prescription treatment but immediately recur. Multiple courses of treatment are needed. Different antifungal medications are tried without lasting success. What you absolutely must do if experiencing recurrent yeast infections fitting this pattern is get your blood sugar tested comprehensively. Fasting blood glucose, measuring blood sugar after overnight fast, hemoglobin A1C showing average blood sugar over the previous 3 months, or oral glucose tolerance test can diagnose diabetes or prediabetes. If diabetes is found and blood sugar is brought under control through diet, exercise, weight loss, and medication if necessary, yeast infections typically decrease dramatically in frequency or resolve completely. Treating the infections repeatedly without addressing underlying diabetes means they'll keep returning indefinitely no matter how many antifungal treatments you use. Sign number 7. Unusual skin rashes, dark patches, or recurrent infections under the breasts or in skin folds. Moving to another important skin-related symptom, women with undiagnosed diabetes frequently develop various skin problems in areas where skin touches skin, particularly under the breasts, in the groin area, in abdominal folds, between buttocks, and in armpits. Here's the mechanism explaining why this occurs. High blood sugar creates multiple interconnected skin problems simultaneously. Yeast organisms, including Candida, and bacteria, including Staphylococcus, thrive in the glucose-rich environment on skin surface and in skin secretions. Nerve damage from diabetes, called peripheral neuropathy, impairs normal sweating patterns. Skin becomes excessively dry, cracked, and prone to breakdown and infection. Poor circulation from damaged blood vessels prevents proper wound healing and delivery of immune cells to fight infections. Skin fold areas under breasts and in the groin are naturally warm, moist, dark, and have constant skin-to-skin contact and friction, creating ideal conditions for fungal and bacterial growth. In women over 60, especially those who are overweight or obese, these folds trap significant moisture from sweating. When blood sugar is chronically elevated, the combination becomes particularly problematic. Common skin manifestations in these vulnerable areas include intertrigo, a red, irritated, inflammatory rash in skin folds that may be moist or weeping, intensely itchy, and have a distinctive unpleasant odor. Candidal infections appearing as bright red rash with characteristic small pustules or satellite lesions at the borders. Bacterial infections, including cellulitis, causing warm, red, swollen, painful areas that may spread rapidly, and and acanthosis nigricans, dark brown velvety patches of thickened skin typically appearing in armpits, groin, back of neck, or under breasts, indicating severe insulin resistance. Research from Diabetes Metabolism Research and Reviews examined skin manifestations in people with undiagnosed diabetes. Studies found that approximately 30 to 40% of people with undiagnosed type 2 diabetes had significant skin problems, including infections in skin folds, at the time of diagnosis. Many patients reported experiencing these troublesome skin issues for months or even years before diabetes diagnosis, attributing them to poor hygiene, excessive sweating, aging-related skin changes, or weight gain rather than recognizing them as potential diabetes symptoms requiring medical evaluation. What makes these skin problems particularly significant as diabetes indicators is their persistence and pattern of recurrence despite appropriate treatment. Normal skin irritation from moisture, friction, or temporary imbalance improves within days to weeks with keeping areas clean and dry, using antifungal or antibacterial treatments, and reducing friction. Diabetes-related skin problems persist despite good hygiene practices and appropriate treatments, or clear temporarily with aggressive treatment, then immediately return when treatment stops because the underlying high blood sugar continues creating the favorable environment for infection. What you absolutely must do if experiencing persistent or recurrent skin infections and skin folds is get comprehensive blood sugar testing, including fasting glucose and hemoglobin A1C. If diabetes is diagnosed and blood sugar is brought under good control with A1C below 7, these skin problems typically improve dramatically within weeks to months. Additionally, keep affected areas as clean and dry as possible by washing daily with gentle soap, thoroughly drying, including using hair dryer on cool setting if needed. Use antifungal powder containing miconazole or clotrimazole in skin folds if fungal infection is present. Wear properly fitting supportive bras without underwires to reduce moisture accumulation under breasts. Change underwear twice daily if needed. Wear breathable cotton fabrics, avoiding synthetic materials, and lose weight if overweight or obese to reduce depth and severity of skin folds. Sign number 6. Unusual patches of dark, thick, velvety skin on the neck, armpits, or groin area. Closely related to the previous sign, acanthosis nigricans deserves special attention as it's a highly specific diabetes and insulin resistance warning sign. This distinctive condition causes dark brown to black, thick, velvety textured patches of skin typically appearing in body folds and creases, including back of neck, especially the nape, armpits, groin and inner thighs, under breasts, and sometimes on knuckles, elbows, or knees. The affected skin looks dirty or unwashed as if you haven't bathed, but vigorous scrubbing doesn't remove the discoloration because it's not dirt or poor hygiene, but actual structural changes in the skin itself. Here's why this characteristic skin change happens. Acanthosis nigricans results directly from insulin resistance, the fundamental metabolic abnormality underlying type 2 diabetes. When your cells don't respond properly to insulin signals to take up glucose, your pancreas compensates by producing more and more insulin to try to overcome the resistance and maintain normal blood sugar. Very high insulin levels circulating in the bloodstream cause skin cells, particularly keratinocytes and fibroblasts, to reproduce too rapidly and abnormally. The excess proliferating skin cells accumulate, creating thickened skin. These cells contain melanin pigment, causing the characteristic dark color. Research from the American Journal of Clinical Dermatology examining acanthosis nigricans found that 70 to 80% of people with this skin condition have underlying insulin resistance, pre-diabetes, or established type 2 diabetes. The skin changes often appear years before blood sugar becomes elevated enough for diabetes diagnosis, making it an important early warning sign. Studies show that women with acanthosis nigricans have 7 to 10 times higher risk of developing diabetes within 5 years compared to women without these skin changes. The skin changes typically develop gradually over months to years, starting as slight darkening that progressively becomes more pronounced. The texture becomes thickened and velvety. The affected areas may feel slightly raised compared to surrounding normal skin. Some people experience mild itching in affected areas, though many have no symptoms beyond the visible appearance. What you absolutely must do if you notice these characteristic dark velvety patches developing is get tested promptly for diabetes and insulin resistance. Testing should include fasting blood glucose, hemoglobin A1C, and possibly oral glucose tolerance test or fasting insulin levels. The skin changes themselves don't respond to topical treatments, bleaching creams, or exfoliation. They only improve when underlying insulin resistance is addressed through significant weight loss of 10 to 15% of body weight, regular aerobic and resistance exercise, dietary modifications reducing refined carbohydrates and added sugars, and sometimes medications like metformin that improve insulin sensitivity. Sign number 5. Frequent urinary tract infections or bladder infections occurring every few months. Urinary tract infections, or UTIs, become significantly more frequent in women with undiagnosed or poorly controlled diabetes for multiple interconnected reasons. High blood sugar appears in urine when blood glucose exceeds approximately 180 milligrams per deciliter, the renal threshold. This glucose in urine creates an ideal nutrient-rich environment for bacteria to grow and multiply in the bladder. Immune function is substantially impaired by high blood sugar, so your body can't fight bladder bacteria effectively. White blood cells don't migrate properly to infection sites and don't kill bacteria efficiently. Nerve damage from diabetes, called autonomic neuropathy, can affect bladder nerves, preventing complete bladder emptying during urination. Residual urine sitting stagnant in the bladder provides bacteria a protected place to multiply between urinations. High blood sugar impairs the bladder's natural antibacterial defenses, including the protective glycosaminoglycan layer lining bladder walls. Research from Diabetes Care examining infection rates found that women with diabetes had twice the risk of UTIs compared to women without diabetes. The risk was even higher in women with poorly controlled diabetes, with A1C above 8%. Many women reported experiencing noticeably increasing UTI frequency in the months to years immediately before diabetes diagnosis, going from rarely having UTIs to getting them every few months. Characteristic symptoms of UTI include burning, stinging pain during urination, urgent, frequent need to urinate but passing only small amounts, sense of incomplete bladder emptying, cloudy or foul-smelling urine, pelvic pressure or discomfort in lower abdomen, and sometimes visible blood in urine, making it pink or red. What pattern suggests diabetes as an underlying cause is recurrence and frequency. Getting UTIs 3 or more times yearly, infections that clear completely with appropriate antibiotics but return weeks to months later, or infections requiring multiple antibiotic courses indicate an underlying problem fueling the infections. What you absolutely must do is get comprehensive blood sugar testing, including fasting glucose and hemoglobin A1C if experiencing recurrent UTIs. If diabetes is found and blood sugar is brought under control, UTI frequency typically decreases substantially. Additionally, urinate immediately before and after sexual intercourse to flush bacteria, wipe front to back after using toilet, never back to front, stay well hydrated, drinking 8 to 10 cups of fluids daily, avoid holding urine for long periods, empty bladder completely when urinating, consider cranberry supplements or D-mannose, which may help prevent bacterial adherence, and wear cotton underwear, avoiding tight synthetic fabrics. Sign number 4. Slow healing of cuts, scrapes, or sores, especially on feet and legs. Women with undiagnosed diabetes notice that minor injuries that should heal within days to weeks instead take weeks to months to heal or don't heal completely. Here's why. High blood sugar damages small blood vessels throughout the body through multiple mechanisms, including glycation of proteins, oxidative stress, and inflammation. Poor circulation means inadequate oxygen and nutrients reach the wound site. Immune cells, including neutrophils and macrophages, can't reach the area effectively to fight infection and promote healing. Growth factors necessary for tissue repair are reduced. Nerve damage means you may not notice injuries promptly, so they become worse before treatment starts. Research shows that even mildly elevated blood sugar in the pre-diabetic range impairs healing. Cuts, blisters, and abrasions on feet are particularly dangerous in diabetes because foot circulation is often poorest and peripheral neuropathy prevents feeling injuries. What starts as a small blister from tight shoes can progress to a serious infected ulcer requiring hospitalization, intravenous antibiotics, or even amputation if diabetes is undiagnosed and untreated. What you must do is inspect feet daily if you have risk factors for diabetes. Use a mirror to see bottom of feet. Get blood sugar tested if wounds heal slowly. If diabetes is found, meticulous foot care becomes essential. Sign number 3, unusual tingling, numbness, or burning sensations in hands or feet. Peripheral neuropathy, nerve damage from chronically high blood sugar, causes abnormal sensations. Symptoms typically start in feet, described as tingling, pins and needles, burning, electric shocks, or numbness, often worse at night, disrupting sleep. Research shows 50% of people with diabetes develop neuropathy. It often begins during pre-diabetes before diabetes diagnosis. Controlling blood sugar prevents worsening but doesn't fully reverse damage. Get tested immediately if experiencing these sensations. Sign number 2, blurred vision that comes and goes or gradually worsens over weeks. High blood sugar causes fluid shifts in eye lens, changing its shape and focus. Vision becomes blurry, fluctuates as blood sugar changes, and reading becomes difficult. Getting new glasses doesn't help if diabetes is the cause. Get blood sugar tested before assuming vision changes are just aging. Sign number 1, unexplained extreme fatigue that doesn't improve with rest. Overwhelming fatigue is common in diabetes. High blood sugar means glucose can't enter cells for energy despite high blood glucose. Cells are starved. Additionally, frequent nighttime urination disrupts sleep. Get comprehensive testing if experiencing unexplained profound fatigue. These weird symptoms, especially multiple occurring together, warrant diabetes testing. Testing is simple: fasting blood glucose, A1C, or glucose tolerance test. Early diagnosis prevents serious complications. Which symptoms surprised you most? Have you experienced these signs? Share in comments. If this helps identify diabetes early, please share with women you love and subscribe for more life-saving health information.